Hello everyone, and thank you for joining us for this month's Strengthening Families Networking webinar. My name is Kaylin O'Connor from the Center for the Study of Social Policy, and I'm excited to welcome you all. We are today going to be talking about a new paper, 3 science-based principles to improve outcomes for children and families, and we'll be hearing about that paper and the concepts behind it and how it all connects to strengthening families, and hope to hear from you about what you think about it as well. So I'll get us going here. We will start, as we usually do, with some updates from myself at the Center for the Study of Social Policy and from my colleague Martha Reeder at the National Alliance of Children's Trust and Prevention Funds, our co-hosts for these webinars. And then we'll get into our main topic of the day. My colleague Steve Cohen will be presenting. He's a senior fellow at the Center for the Study of Social Policy and the author of this paper for the Harvard Center on the Developing Child. So let's get going on it. I will start with the updates from CSSP. Just so everyone knows, this is a monthly webinar that is open to anyone who wants to participate, typically those who are using the Protective Factors Framework or coordinating strengthening families efforts, whether that's for their program, their agency, their community, or their state. As I said, we jointly convene these between our 2 organizations, and we have a topic or guest speaker each month, which we coordinate, but also open up to you if you have a topic you think you'd like to hear discussed or something you'd like to share. Please let me know. You could always share your own content. You could facilitate a panel of other folks around the country doing similar work. We're very open to whatever helps people learn about new ways that they might apply their thinking about strengthening families, new partnerships, new areas of work and audiences to reach with this content. All of the recordings of these webinars are posted on this Google site maintained by the Alliance. It's an archive at this point of many years worth of webinars, and that includes both the recording as well as the PowerPoint slides and any other handouts that went with the webinar. So I encourage you to check that out if you missed one, or even if you just want to look back and see other topics that we've covered in the past. So we meet on the 2nd Thursday of each month at this time, and our next scheduled webinar is on June 14th. That'll be a focus on messaging the protective factors. So we're going to hear from the Alliance National Parent Partnership Council, as well as from the Great Start Collaborative in Northern Michigan that made some posters that everyone loves and maybe you've been using, to talk about sort of the process that they've used to develop materials to message about the protective factors, particularly messaging out to parents about their own family strengths, and we hope to hear from you about your experiences with that as well. So please join us on June 14th for that one. And then we will be meeting the 2nd Thursday of each month going forward. And as I said, you can let me know if there's a topic that you would like to see covered or that you want to present on, and we can get you onto the schedule. So a couple updates from CSSP. There's a handout called Strengthening Families as a Platform for Collaboration that many of you have used, certainly have seen. It's the one with that daisy image on the back, on the 2nd page of it. And it was in the format from an older batch of Strengthening Families materials. It had not been updated when we revised our website and all our materials in 2014, but it became clear to me that many of you were still using it. And so I just updated it. The content was still very relevant. Just pulled it into our newer format, remade that daisy graphic with help from our communications team, and I'm happy to share that with you. It's on this webinar in the handouts list, so you can download it right now, and it'll be posted on our website any day now. It'll be in the newsletter that goes out later this month, so you'll be able to download it then as well. But in case you regularly use this one and you'd like to grab it now, you can get it here within the webinar. I wanted to make sure that everyone's aware of the new funding opportunity for Essentials for Childhood from the Centers for Disease Control and Prevention. Many of you are familiar with this work already, and you probably got the announcement, but just in case you didn't, wanted to make sure you know that's out there. The link is here on screen, and proposals are due June 18th. Those are coming from state public health departments. There's a strong focus in this new opportunity on measuring risk and protective factors, and so it's an opportunity to connect with your public health department and find out how you could enhance your Strengthening Families work with them if you aren't already, or to build on what you're already doing together. We do have a handout, which is also available here on the webinar as a handout, that makes the link between Strengthening Families and the Essentials for Childhood framework. So if you're talking with public health folks and you want them to see that the framework you're talking about is closely related and complementary to the Essentials framework, use that handout. And let me know if you have questions about this. 5 years ago, when the first Essentials funding opportunity came out, we provided some guidance for public health departments and for Strengthening Families partners for how to talk about how you would be connecting the work or how you might consider connecting the work. I'm not sure that we're going to have the capacity to do that for this one before June, but would be happy to talk through it with you if you are working on that. And I see someone just typed in a question about whether there are slides. I hope that doesn't mean that no one can see the slides. So if someone wants to type in if you can see the slides, that would be helpful. I am going to keep going, but perhaps Trish, who's on the line, can help Jesse, who's having a connection problem, I think. All right, thank you. Oh, lots of people typed in that you can see the slides. Thanks, team. All right, so here we go. Another new product from CSSP that I wanted to draw your attention to is about opportunities to strengthen developmental screening for children involved in child welfare systems. We know that these are some of the young children that we're most concerned about, and yet we also know they don't receive developmental screenings at the rates that we would like. So this is an issue brief about some strategies for increasing how many children involved in child welfare are getting those developmental screenings. So there was a blog post about it in April. The link is there, or you can just go to cssp.org and go to our blog to find that. Or actually, if you go to cssp.org, this is one of the papers that's listed right there at the top as a new release. So grab it there if you work with child welfare systems, or if your focus is on developmental screening. Could be very useful for figuring out how to better reach those kids. And one other announcement that I'm excited to share. We are working, I'm working along with the National Family Support Network and the Greater Cleveland Family Strengthening Network and with many other partners as well, to plan a conference in October. So we've got the dates and the location pinned down now, October 15th through 17th in Cleveland, and we just selected a name for this event, so it's called Together for Families, Strong Families, Promising Futures. We'll be focusing on strengthening families, on the standards of quality for family support and strengthening programs, and on the field of family support more generally. So if you're on this webinar, you are definitely in our target audience for who we'd like to attend this webinar and who we'd like to consider proposing a session at the webinar, at the conference. So we will be putting out a call for proposals later this month, and then the registration details will come after that, but just wanted to make sure that everybody knows that's coming up. And we're very excited to bring together some of our strengthening families, family support, and standards of quality people to dig in on these topics that we all care so much about. Okay, with that, I'm going to hand off to Martha Reeder, Senior Associate at the National Alliance of Children's Trust and Prevention Funds, for a few updates from them.
Thank you, Kaylin. Good afternoon, everyone. I'm really glad to be here, and I see many familiar names in the list of the attendees, and so it's always great to connect with people that you had the opportunity to work with. I wanted just to share with you this afternoon a little bit about our neglect training sequences. I know there have been some materials on the webinar before, but I'd like to just give you a little bit of an idea of what is contained there, and they're posted on our website. We work together with CANTASD to develop these materials, and they're based on the research that was done by Karen Kaplan several years back, and many of the concepts and the ideas come from that research and what we know about preventing child neglect. And if you'll go to the next slide, you'll see that we have a discussion toolkit that, and you can go ahead and just fill in all the spots in it. For each learning sequence or training sequence, there are 4 separate ones, and they build on each time the content builds on the previous content. And so this is what you find in our discussion toolkit that supports each one of the training sequences. And to really just break it down, each training sequence is built on a video. And in that video, and the video is short, anywhere from 5 minutes to 12 minutes, the videos are, and they have actual video footage from both professionals in the field and also from parents talking about the experience of neglect in their families, what helped to prevent it, and just some very honest discussions about some of the issues around child neglect. And so using that video each time as a basis for conversation, and the discussion toolkit just gives you some suggestions and tools in various contexts of ways that you can bring this content into a meaningful discussion. It can be used in so many different settings, and the basic content is the first sequence deals with just an introduction to what is the definition of neglect, and what do various factors have to do with preventing child neglect. The second sequence talks about the knowledge around what we know, what the research is, what we know about child neglect already, and maybe some misconceptions about what causes it. And then the third sequence really brings in some strategies and some ideas about ways that it can be prevented across the social ecological model, and really based on building protective factors in order to prevent child neglect. And the last learning sequence talks about very manageable steps, very concrete steps at each level of the social ecology that you can think about and you can enact right now. So I would challenge you to please take a look at these and let me know if you have any questions about the use of them. Many innovative and exciting tools that are part of the discussion toolkit. So let's quickly move to the next slide. And again, I just want to share with you that the Alliance National Parent Partnership Council recently finished their third infographic on the protective factors, this time on the knowledge of parenting and child development, and just want you to be sure and have a chance to download that and look at it. And the link is there on your screen. And they're working on a different approach to gather the information that they are going to use for social emotional and for concrete support. And you'll hear more about that later. And next month, as Kaylin shared with you, they will be sharing with you more about how this process looks for them and how they go about deciding how to message around the protective factors. That's all I have today, so thank you very much, and I'm looking forward to the rest of the webinar.
Thank you, Martha. All right, so those were all the updates, and we're going to get into our main topic today. I'm very pleased to introduce Steve Cohen, a colleague at CSSP and also works at Harvard at the Center on the Developing Child, where he wrote this paper that you can download, again, from the handout section there on the side panel. If you haven't seen the paper itself yet, Steve's going to talk through the concepts there. And please be thinking about how this applies in your own work. We encourage you to type in questions if you have them, and we'll get to questions at the end. Or if you are a place where you can unmute yourself to speak and you want to share some reflections or questions, we would welcome that too once we get to the discussion time. So with that, I'm going to hand this off to my colleague Steve, and just let us know what you're thinking about this as Steve goes. Here you go, Steve.
Thank you, Kaylin, and thanks everyone for joining today. Let me open with a little bit of background about why the paper that this presentation is based on came about. The headline is Taking Up the Challenge of Moving from Scientific Insight to Action. The Center on the Developing Child at Harvard over the last decade or so has been translating complex scientific findings from a whole bunch of fields into language that makes them clearer to the rest of us who don't read scientific journals every day. And in doing that, they've helped us understand how child development works and in particular what they've called the biology of adversity. That is, the mechanisms by which early adversity can get under the skin and influence development with effects over a child's entire life. The purpose of doing all that is to get people to generate and test and use new ideas grounded in this improved scientific understanding that can lead to breakthrough outcomes for young children, especially those who experience the greatest challenges. And as they've done that work, they've heard two groups of reactions from people who run public systems, from policymakers, from those who concern themselves with the well-being of children and families. On one hand, tons of interest and lots of optimism that the science can open up new pathways to better results. And we all hear this just in our daily lives, the frequency with which we hear people talking about things like brain science and toxic stress is testimony to the effect that this work has had. But on the other hand, lots of questions about how. How do I get from understanding a scientific concept to the thing that I and the people I work with will do differently tomorrow morning or next week or next year that will lead to a better result for children and family? What's the way to get to action here? And that's the road we were trying to go down in developing this paper, to begin to articulate some principles that will bring a step closer to action, that can guide people in thinking about how do I apply these scientific concepts to the work I do, and to include in the paper enough practical examples to at least show people how the principles could be used in a few different settings. Let's move to the next slide. I'm going to spend the first few minutes of the presentation doing a kind of science refresher, and I think it probably will be a refresher for most of you because these ideas are out there in the world, but I think it'll be helpful for you to have them fresh in your minds as we speak. For those of you for whom any of this is new, I encourage you to visit the Center on the Developing Child website, which has lots of useful materials, not only written documents, but also videos that allow you to delve into whatever you're interested in. So you see up here three science concepts, the first of which is that brain development is an active process. Vast numbers of neural connections are formed in early childhood. Neural circuits that are used are reinforced, while those that aren't used are pruned away. Responsive relationships with caring adults, characterized by what scientists have come to call serve and return interactions, are essential to strong brain architecture that will support healthy development. We'll talk a little bit more about this later. Now I want to focus on the next two concepts in a little bit more depth. So you see them here on the screen. I'm going to move us right to the next screen and go into the second one. So next slide, please. The second concept here is that adversity, and Kayla, I realize this was done in such a way that, yeah, thank you very much. Pull them all up on the screen at one time. Thank you. Adversity can disrupt development with lifelong consequences across many domains, including health, learning, and social relations. The scientists have come to describe the mechanism by which that happens as toxic stress, a term that's used a lot, not always with a definition attached to it, so I'm going to talk about it some. But before I go there, let me take a step back and draw a distinction that will turn out to be important for language. We encounter stressors in the environment, and we respond to them. Stress is what happens in us, not what happens to us. Scientists use the word stress to describe the reactions within our body to what we're experiencing. And when they think about the experiences that young children have and the kinds of stress reactions that they have as a result, they've come to categorize those stress reactions under the three headers that you see here on this slide. The first of them is the positive stress response. Brief increases in heart rate, mild elevation of hormone levels, a normal, essential part of healthy development, common when a child has a new experience or encounters a developmental challenge. You got to have positive stress reactions in order to develop all the things that children have to do. The second is the tolerable stress response, which involves greater and longer lasting reactions, typically to more serious challenges, such as the loss of a loved one or a serious injury, but with help from adults, the child adapts without lasting harm to development. And the third, as you see at the bottom of the slide, is toxic stress, which scientists describe as the excessive, prolonged activation of stress response systems in the body and brain in response to serious adversity. It creates challenges to healthy development and increases the risk for stress-related health and learning problems well into adulthood. Scientists are trying to develop tools now that will allow them to actually measure this and to understand whether an individual child is actually experiencing toxic stress. But for now, you should still think of this, I think, as a concept, a way to describe a state in which a young child's development has come to be focused on immediate survival needs, with high attention to threats from the environment and frequent fight or flight reactions, rather than focusing on the architecture that will build skills over a lifetime. With that, let's move to the next slide, and I'll talk about the third core scientific concept, which is about core skills for life. Executive function and self-regulation skills are mental processes that help us plan, focus attention, remember instructions, and juggle multiple tasks successfully. These skills include things like working memory, which is the ability to hold multiple pieces of information and ideas in your head at the same time so you can draw on all of them as you figure out what to do next. Mental flexibility, which is the ability to use different ways of thinking about different problems and to suit your tool to the problem you're trying to solve. And self-control, which speaks to our ability to withhold impulsive action, respond to impulses, and still act in the way we need to in the world. When we're able to make good use of these skills, we can remember our goals and the steps we need to follow to reach them. We can ignore distractions along the way. We can come up with a new plan if our first plan doesn't work out. The key thing I want you to remember about this concept is that scientists believe that these skills are the foundation for successful adult behaviors across many different areas of life, including both parenting and work. And now I want to relate this back to the second concept. Childhood adversity through toxic stress challenges the development of these capabilities. Recall what I said a moment ago about developmental attention being focused on immediate survival needs rather than longer-term needs. Let me add one more thing to that. It doesn't mean that you don't have any self-regulation or executive functioning skills. If we're talking about a developmental challenge, it doesn't mean people can't continue to develop these skills in adulthood, though often it takes more effort to do so. And I've been talking so far about challenges that we all experience during development. Think a little bit about the challenges that people experience later in life as well. Exercising these core adult functions is effortful. They can be depleted. Lots of studies show how much harder it is, for example, to exercise self-control right after you've engaged in another task that requires lots of executive function skills to be used. So when people face lots of adversity, which throws stress at them again and again, I should follow my own injunction about language, throws stressors at them again and again and again, and which creates further demands upon their own executive function and self-regulation skills, that challenges their capacity to use the capabilities that they do have. We're going to talk about that again in a moment as well. Now let's make the transition to talking about the three principles in the paper with the next slide. The challenge, and again, Kaylin, please put up all the pieces of this one. One more to go. Thank you very much. As you can see, these slides were borrowed from a presentation that was done one piece at a time, but I'm going to try to get the whole thing up at once. The challenge we took up with the paper was what guidance the center could offer to policymakers and practitioners that could help them use the science in their work. And you see here the three principles. I'm going to talk about them briefly, starting on the left, and then go into a little bit more detail about each of them in the next few slides. The first principle is to support responsive relationships, relationships that meet basic needs, buffer stress, and are characterized by serve and return for young children and its analogs for older youth and adults. The security of relationships supports healthy growth in children and positive change in adults. The second principle, moving around that circle towards the right, is to reduce sources of stress. Stress both in the individual's day-to-day environment, home, school, the workplace, the community, and in the individual's interaction with public systems and service programs that can actually generate more stress that they have to deal with. Reducing stress allows child development focused on long-term needs rather than immediate survival. For adults, it frees up energy to engage in responsive relationships and for adults to build their own skills. And finally, going down to the bottom of the circle, the third principle is to strengthen those core life skills. Self-regulation and executive function, again understood as capacities that adults need, both to be capable parents and successful workers, and as capacities whose development needs to be supported in children and youth. Strong core skills support success in all walks of life. Now let's take a look at them in a little bit more detail, starting on the next slide. Many pieces again. One more to go. Sorry about that. Thank you. So let me start with the what. When we talk about supporting responsive relationships, what are we thinking about? Lots. Let me start with the obvious. The core, of course, is the relationship between parents or adult caregivers and their children. But we also mean relationships between parents and the adults they rely upon, both for social support and for concrete assistance in times of need. And we also mean relationships between workers and the people they're trying to help across a wide variety of service systems. For children, you see up here on the slide, I'd like you to think about two different ways in which these responsive relationships support their development. One is a kind of a positive effect, which is it provides enrichment. It provides a kind of bath of the serve and return interactions in which an adult responds to a child's cues, the child then responds to the adults, and the interaction continues. The interactions that build strong brain architecture. And it also provides protection. When children do experience stressors, when they have trouble regulating themselves, support from an adult provides the buffering that they need to help their stress response systems return to baseline rather than remaining persistently activated. For adults, supportive relationships are a key way to manage stress as well, as we turn to others both for emotional support and for concrete help. And they also make it possible for us to take risks. The risks of trying out new skills, learning them, practicing new behaviors, even when they're not comfortable for us. Now let's move to the next slide and take a look at some examples of this principle in action. I don't think I'm going to talk you through all of these. Maybe I'll pick out one of them from each of the categories. We tried to think a little bit across a bunch of different systems about where you might see these ideas show up. So for example, on the policy side, we said one of the main challenges that so many systems face is that workers can have caseloads that are so large that they can barely do the tasks that are assigned to them. And that, of course, makes the work of developing a real relationship with clients, whether those clients are children or adults, very difficult. In practice, we thought about where are the opportunities for workers in multiple different systems, both to model responsive relationships in the way in which they interact with their clients, both children and adults, and to coach adult caregivers on how to engage in serve and return relationships with their own children. Let me move to the next slide. We're going to move into the second principle again. This is the one about reducing sources of stress. Let me start again with what? Let's go back one, I think, Keelan. Oh, no, that's right. Thank you. You good? Let me start again with what we're thinking about. So what are the sources of stress that we have in mind? A whole bunch again. The consistency and safety of the caregiving environment for children, including the ability to have predictable household routines. The safety of the physical environment that children and adults experience at home and in the community. The financial pressures that adults have to deal with. Other major pressures, of course, that some adults experience, like domestic violence or mental health challenges. The stresses that can be induced by interacting with systems, especially when adults have to deal with multiple systems or deal with multiple and conflicting requirements within a given system. And for too many people, the additional stress generated by racism and or by related challenges such as immigration status, which can create an environment of pervasive stress for so many people. For children, we experience the importance of this principle pretty straightforwardly. Anybody would say it's better for a child to grow up in a community where she feels safe than to live in a dangerous place, even if she has fantastic parents who do a great job protecting her. For adults, I think it's less obvious sometimes how important this principle can be. Recall the point about how easy it is to deplete executive function and self-regulation. The kinds of stressors I was talking about a moment ago make persistent, powerful demands on these capabilities. Think about how much more important a decision about a small amount of money is for someone who doesn't have enough money. Reducing these stresses increases the likelihood that people will be able to make plans and follow through on them, regulate themselves, and to the needs of their children. Let's go to the next slide and look at a couple of examples again. On the policy side, we thought about this largely in terms of the ways in which systems ask families and children to interact with them. So we thought about the opportunities to remove stress by streamlining eligibility processes and by making available emergency supports to families. In practice, we thought about the opportunity, even in systems that don't routinely do this, to attend to ask about major stressors that families encounter that may become the primary barriers that adults and children experience being able to be successful in the context of a service system. We thought, of course, about looking for and finding ways to mitigate sources of stress within the service system itself. We thought about all of the opportunities that workers in a bunch of systems might have to help parents learn how to create better regulated home environments that reduce stresses for their children. Again, just a handful of examples here of ways in which one might take this principle and apply it to practice. Let's go to the next slide and start to talk a little bit about core life skills. And this one I will talk through in a little bit more detail. You remember that we're talking about skills related to focusing attention, planning, controlling impulses, monitoring and adjusting plans. I talked about those skills as core skills of adulthood, but of course they begin development in childhood. And especially as children get older, they come to be quite critical as children come to make more decisions on their own. So these skills in development nevertheless become critical to both educational and social success for children. And as those skills develop, they build young people's ability to resist decisions that risk health. For adults, core life skills make it easier to provide responsive care to their children. I'll come back to that in a moment. And to maintain a stable home environment. And they also make it possible for people as workers to manage the demands of the workplace. But there's another piece of this that we haven't talked about so much yet. And that's about self-belief, agency. When people have experienced toxic stress growing up, and when they experience further adversity later in life, it's awfully easy for them to get caught in a cycle in which it can appear that nothing that they do has much impact on their lives. And when they begin to strengthen their core life skills and see their own ability to make change, it promotes a different belief that we can actually influence our own future, which of course is the foundation of any major change that people are able to accomplish. Strengthening core life skills also helps people manage stress better, simply because they're better organized and able to do it more. Now let's go to the next slide. I want to talk about how these pieces fit together. Sorry, one more. I have some examples for you before I do that. So once again, some examples of applying this notion of strengthening core life skills to policy and practice. And I think this one bears some discussion. You know, when we think in multiple different service systems about what it is that we're asking our frontline staff to do, or what it is that we're buying from programs that deliver services, we haven't often thought about executive function and self-regulation skills as goals that actually can be approached through multiple different kinds of services. So whether someone is in a parenting skills class or a job training program, given the argument that the same core set of skills are relevant in many different sources of lives, they can actually be working on those skills in all of them. And that means that naming those skills as a target of intervention in lots of places is an important step for policy. And similarly, in choosing what to do, policymakers can prioritize programs that target these skills and crucially provide opportunities to practice them. I think this among the principles is maybe the clearest of the notion that the center has often had, that simply providing people with information is rarely enough, and what's critical is to give people the opportunity to practice, to fail, but to fail in ways that aren't catastrophic, and then to try again and succeed. And that requires an approach to service delivery and to programs that's built around practice and coaching. So that leads me to the bottom of the slide. In practice, we can explore in a bunch of systems coaching models in which we're helping people do their own planning, stress test their planning by seeing what might go wrong, try it out in small steps, provide them with feedback, help them over the hurdle when they get stuck, let them try again, etc. So the language sometimes used for this is scaffolding, right? That is this idea that we're building the supports for people that let them go up higher and higher so they can't fall down all the way to the bottom, and that allows them to take steps that are safe. And particularly note with regard to scaffolding, some of the papers go into this in some more detail, some very simple, concrete supports like giving people timelines, giving people frequent feedback about what they're doing, etc. Let's go to the next slide. The next slide is, for me, the thing that in some ways made the three principles the most interesting, which is the idea that these actually aren't separate and isolated ideas, but they are deeply supportive of one another. That is, intervening anywhere along that circle can have positive effects in the others as well. Let me give you a couple of examples about that. So think about a parent who has an opportunity to build, practice executive function and self-regulation skills. That parent's child, as all children sometimes do, exhibits challenging behaviors, and the parent is now better able to remain calm and focused during that interaction and to respond in a way that's calm and reassuring. That helps the child's stress level go down. It helps the child begin to build her own core skills. It also reduces the stress the parent is experiencing from the interaction with the child, and it provides positive feedback for the relationship that strengthens it for the next time there's a more challenging problem. Or think about the parent who experiences less stress from the environment, right? Given more space, given more bandwidth, the parent is able to make more realistic plans for how to balance job training and childcare, and better able to deal with challenges that get in the way. Each time the parent does that, he or she is actually practicing and building those executive function and self-regulation skills. You could make up many other such examples, but one of the things that interested us in this approach was this notion that starting anywhere could help you get to all of these principles together. Let's move to the next slide. We're coming towards the end of my presentation now, and I want to talk about two more things before I finish up. The first is the relationship between the principles and the protective factors. It shouldn't be a surprise to anybody to see a whole bunch of connections here. They're not one-to-one. So for example, if you look at supporting responsive relationships, you could probably work your way through the 5 protective factors and think about how supporting responsive relationships could actually help with all 5 of the protective factors, though in slightly different ways. You could also map the arrows back in the other direction in a couple places as well. I'm not going to try to do that mapping for you. It should be no surprise that these are closely related to one another. They come from the same fundamental research and understanding of how people develop, although strengthening families got there first. I was thinking about, in preparation for this presentation, the question, if the protective factors were just being created now, what effect would the 3 science-based principles have on them? That's not a question which I can give you a definitive answer to. It would be an interesting conversation for us to have during the discussion period. I want to name the one thing that stood out most to me, and that is that I suspect that if we were doing the protective factors today, the one that's labeled knowledge of parenting and child development, we'd push a little further towards the capacity around parenting and child development. That is, the notion of core life skills would push us beyond what people know to what people are able to act upon. And we look upon that particular protective factor, particularly with an eye towards not just what's telling people what they could know about parenting, but what's actually helping them build the skills to act on that knowledge. Let me turn to the next slide and say a word about so what, right? So we've got some core scientific concepts. We've got these 3 principles: responsive relationships, reducing stress, building core skills, right? There's still a long way from having 3 principles to deciding what to do differently tomorrow morning when we go back to the rest of our work. So what are the ways we might deploy those principles to help us? 3 pretty straightforward and simple ideas here on this next to last slide. The first 2 of them are about the principles as a kind of a screening device, right? So the first is, you might think about, okay, when we're looking at a piece of our current operations, or we're looking at a policy, perhaps because we think it's an area where we're experiencing some challenges, the principles can become a screen. As we analyze what we currently do, we could ask the question, how does what we do build relationships? How does what we do reduce stress on the people we're trying to help? How does what we do help people build their core skills? Are there ways in which what we're doing are counterproductive? We might be getting in the way of relationships, or creating more stress, or doing things that make it more difficult to build stronger skills, right? So there you've got a kind of screening function that might help you not necessarily make enormous changes, but identify some of the tweaks that might allow you to do almost the same thing, but with greater consistency with these three principles. The second piece of this slide is the obvious flip side of that coin, which is we change things all the time, and people make proposals for how we might change policy or system operations. Those proposals get made for 1,000 different reasons, often reasons that are far removed from these three principles. And the three principles could be a kind of useful final check on our proposals to change what we do. We might ask the question, if we do this instead of what we were doing before, will we be doing a better job of promoting these three ideas, a worse job, or the same? And again, to look for the tweaks that might take other opportunities for change that are going to happen anyway to build these principles into our activities. And finally, the last of these, this is a bigger one, and so it's one that I suspect will be used considerably less often, especially when leadership has already been in place for a while, and so has created a framework for communicating with staff and stakeholders about what they're trying to do. But when there's leadership change, when there are major changes in organizations, it's always the case that leaders who are thinking about significant change have to find a framework for communicating their ideas so that they don't wind up with a laundry list of 75 different things that don't have an obvious relationship to one another, but they've got a few big concepts that they're asking their staff and their other stakeholders to learn and start to apply. And this is surely a potential framework, one among many, no doubt, but might be for some places at some times an opportunity to say, we're going to go down the road of trying to strengthen these three things in the work that we do because of the strong links to the science that tell us that this should be a way to get to better outcomes for children and families. So with that, let me turn to the concluding slide, which has on it only a couple of links for you. One of them is the link Kaylin's already noted, and she's put on the invite to this webinar, and that is to the Three Principles paper. The second one I'll just take a moment to mention. The paper I've been talking about was actually not the first product we did in this project. We started out by diving into considerably more detail into the field of child welfare and asking the questions, how might the science influence policy and practice in child welfare? That's the focus of a longer paper, which is the second link here. It hadn't distilled quite the three principles yet. It goes into more detail about the science. But for those of you who work in child welfare or who are interested in it, there are a whole bunch more examples in there, and they might allow you to delve into a little bit more concrete examples of the thinking. So you might want to take a look at that one as well. With that, let me thank you again and turn this back to Kaylin to lead the discussion and question and answer period.
Thank you, Steve. I think that was a lot of great content, and I think everyone's very grateful. We did have a couple of questions typed in. The first one is a logistical question. I'll answer that first. Nancy is asking, can you please share again information about the upcoming October conference? That will be October 15th through 17th in Cleveland. The 15th will be a pre-conference day with some full-day sessions, and then the conference itself will be the 16th and 17th. So we don't have a website set up or anything for it yet. We just, like, I added that slide because I got off a planning call right before this webinar started, and we have enough information solid enough to share that, but it's not quite ready for a website yet. But we are working away on making those plans, and a request for proposals will go out soon. So feel free to contact me if you don't get that in our newsletter, or if you're a few weeks go by and you haven't heard anything, do let me know. Okay, so Steve, the next question is for you, although I'll have some thoughts on it too. Erin Havig from Washington State typed in, please share more about why a new lens instead of working with the protective factors framework.
So, you know, I think the answer to that question is to start from the Center on the Developing Child's perspective. That is, I think they deliberately set out not to begin where any number of others have begun. You could have asked the same question about why a new framework rather than trauma-informed care? Or why a new framework rather than starting with the notion of adverse childhood experiences? And I think the answer would be that they began, as I said, by trying to understand what the core scientific concepts were and then taking a fresh look at what do we think are the implications of these core scientific concepts for policy and practice. I think it's good and encouraging for all of us that many of those seem quite consistent with the kinds of things that strengthening families would bring to us. But I do think that there's a new lens here and a different way of thinking that might open up some new ideas as well. You know, I'm fond of saying all God's children got frameworks. There are lots of them floating around out there in the world now. And I don't think anybody intended in setting this out to create a new framework that would be in competition with any existing framework. So for those who've got your way of communicating, your way of organizing information that's working for you, that's terrific. And you might take a look at these three principles and say, is there anything that I might get out of these that I didn't already get from the other one? And then tweak a little bit. For others, starting with this as a framework might be useful. So I hope no opposition there, a chance to build a little bit on a lot of good work done by a lot of folks. Ellen?
Yeah, I was gonna say I frequently quote you on that, Steve, that all God's children got frameworks. I think a framework is useful for shaping our thinking, and if you've got one that works for you, and for many people on this call, the Strengthening Families Protective Factors framework is, you know, so solid and really informs how you approach all these questions. But there's still always room for new pieces to come into the conversation. And so I think, for example, with these three principles, the focus on strengthening core life skills, I don't think we really get to that in the Strengthening Families framework. I think there are things that you do that are informed by the Protective Factors framework that result in strengthening core life skills, but we don't talk about it in that way. And so with the Center on the Developing Child coming out with this approach, it helps us to think about, well, how could we add in a focus on that when we're talking to legislators or you know, system leaders about how they might change their policy or practice, that in a way that that focus on core life skills might hit a particular interest area or make more sense to a specific person than talking about protective factors. And so you can say, you know, knowledge of parenting and child development is one of the things that families need, but when we're increasing that knowledge, we're also strengthening other core life skills, both for the parent and for the child. And so you can kind of pull from this to strengthen your argument or to augment an argument that would be otherwise based on the protective factors. I would encourage anyone else to share their thoughts in response to Erin's question, or to type in your own question, or you can raise your hand here in the webinar and I can unmute you. We did have another question typed in. So Maureen Durning in Idaho wrote in a comment. She said, we do parenting classes in the women's prisons in Boise using the STRONG manual developed by Butterfly Training that Transform. And I love the connections between our lessons and the concept of strengthening core life skills. That's what the focus on reducing recidivism is all about. I think that's a really good point, Maureen. When you're talking about strengthening protective factors in prisoners who are about to go home or women who are on parole, that might sound a little bit fluffy, but some of the people you need to convince about the importance of that work might respond better to core life skills. Steve, any thoughts on that?
Well, only to second the point. It's a great example.
Okay, thank you for that question, for that comment, Maureen. Anybody else? We've got a few minutes more for conversation here if we'd like. I will ask Steve, since we've got some time here, I'll ask you a question myself. Are you aware of places where people have started using these core principles in their advocacy or in actually shaping practice or policy?
I can't
I know the
speak to
paper's
the,
not that old.
Right. I can't speak to the advocacy part of it, and I'd be interested to know if anybody else does. On the practice side of it, and to some extent policy, the Center on the Developing Child has been trying out a variety of different tools to do just that. So, for example, they've had a partnership with the Children's Home Society of America, and one of the things they've done over the last few months is work with a group of children's home societies from different parts of the country that have begun to use a tool based on these principles to look at their own operations and think about what they might do differently, what they might want to do differently as a result of kind of taking this lens to their work. There are a couple of similar examples of their using that in other settings. For example, with a couple of government agencies up in Massachusetts, none of those are ripe yet. I can't tell you a whole story about any of them yet. They represent examples of trying to take this and use it as a lens to think about what we might want to change.
Great. That's a great way to be using it. I'm sure there will be more to come as more people get their hands on this. Okay, so we got a response from Erin, who had asked the question about why a new lens. And she said, I agree that there's room for multiple perspectives, and I like both of these. My curiosity was around why a new lens at this time. Is it the same research base, which you had referred to, Steve? And so if you want to respond to that, the research that the Center on the Developing Child is looking at and translating.
I hesitate here only because this is very much at second hand. That is, I'm neither a scientist nor a researcher, and so I'm speaking from what I'm given to understand, and I hope what I say is correct. I think it is, but I want you all to take it with a slight grain of salt. I don't think it's the same research base for a couple of reasons. One, purely chronological. Strengthening families is over a decade old in the formulation of the protective factors, and much of this work is newer than that. The other, that I think kind of the core research that Strengthening Families relied upon was largely research about human services, research about how families work, research about what leads to better outcomes in the world that most of us work in, whereas the center was starting a couple of steps back with scientific research that's about the process of child development and trying to draw inferences from that. So I think the research bases were probably somewhat different. Certainly the people who did the work were very different in terms of discipline and experience. I think the consistency, that is the similarity of the places where they come out, the fact that you could put these two sets of ideas up next to one another and kind of nod your head and say, yeah, there's a lot in common here, is deeply reassuring. I hope that each one of those research bases has something to add that the other one wouldn't have come up with on its own.
Yeah, I would agree. I think that science of child development and the neuroscience and now down to the biological research on toxic stress, that's much more individualistic or individual-based than the research that protective factors framework was mostly developed based on, which is more at the social level and sort of what characteristics do we see across families that have lower incidence of child abuse and neglect, and so it's a different approach, although our update, the paper that Charlene Harper Brown wrote in 2014 about the Strengthening Families approach, sort of updating based on the new understandings of trauma and adversity and early childhood brain development. I think we updated that and responded to that research to show how the protective factors apply, but the Harvard research is really focused on that area and less on the external and social pieces of it. I think that's fair to say. Okay, we've got another question. Sharon Budka, New Jersey, asks, where do you see empathy playing a role within Principle 1 about supporting responsive relationships?
I'm again hesitating because, I think I could give my layperson's take on that. I bet you if we had some good scientists in here, especially psychologists who've done a lot of research on empathy, they could say a lot more than I could. Empathy certainly can be a basis for a relationship. When we think about relationships between workers and the people they're trying to help, we often talk about empathy being one of the things that's helpful there. I think there's lots more to explore about the things that promote strong relationships in that context. Just some of my CSSP colleagues and I have done a little bit of that work, taking a look at what are the behaviors and attitudes on the part of workers that seem to be most associated with forming very strong relationships with youth, especially youth who'd experienced a good deal of adversity in their lives. And it's interesting to me that empathy was not one of the things that we heard during that conversation. But again, I fear getting in over my head pretty quickly here because there is a whole scientific body of knowledge about empathy that I simply don't have. Kaylin, any thoughts on this?
Yeah, I mean, I think empathy, both the empathy that a parent has for others around them and for their child, and the empathy that we want children to develop, I think that I see that a lot in that serve and return kind of interaction, that the parent having empathy for the child's experience, of the child learning an empathetic approach. But again, I'm further removed from the science than Steve is claiming to be. So those are just my thoughts. But I think that definitely would be a component of it, of what supportive relationships really mean, is about practicing empathy and helping everyone develop greater empathy. I think we're getting some background noise. I'm going to read one more question I think we have time for, and we actually had a couple more typed in, so I apologize, we're not going to get to everything. But Julia Pickup asked, would CSSP give any consideration to incorporating these principles into the Strengthening Families framework, such as highlighting responsive relationships under community supports, reducing sources of stress under parental resilience, adding in opportunities for building core life skills? So I'll address that first, and then Steve, maybe you want to chime in. I would love to develop some materials that kind of draw the connection between our protective factors and these principles. I think there's, as Steve said, a lot of room for exploring how they all fit together. I don't know that that would quite rise to the level of incorporating it into the framework. I'm not sure that we're in a place of considering changing the, well, we're definitely not in a place of changing the framework fundamentally, but we're always open to, you know, integrating different examples and different language into how we talk about the protective factors or the framework or the approach, if it helps it to be more effective. So that's my thought on that. How about you, Steve?
Yeah, I like that, and I also just wanted to say I hope that over time there's also this nice opportunity for feedback in the other direction. That is, for places that do use the protective factors framework to let us know, how do these three scientific principles affect your thinking? What are the opportunities that you've found to connect them to the framework? Do you see any challenges in doing that? Because I think that would help us all a lot in thinking about how we talk about the framework in the world.
Wonderful. And I think that is actually a perfect point at which to wrap up. I'm sorry we didn't get to all the questions, but I know we're at the end of our time. And I just want to thank everyone who typed in questions. It's always a gamble to know if anyone's going to have something to say, but with this great content and you great participants, we got some good discussion going, so thank you for that. I've got our contact information up here for myself and Martha and Steve, and I hope that we will see you again next month, and let us know if you have any questions. And Steve, thank you so much for your work on this paper and for taking the time to share it with us today.
Thank you, and thanks everyone. Bye-bye.
Thanks everybody. Bye.